Welcome to Revitalize Education. Today we're going to be talking about the ABCs of ABGs, better known as arterial blood gases. There are multiple methods to determine the name of an arterial blood gas. You can use the arrow method, a tic-tac-toe method, or an algorithm method such as the one seen below. However, today we're going to be focusing mainly on the Henderson-Hasselbalch equation seen in the corner. But before we can jump into naming an arterial blood gas, we first need to understand the basics of what makes up an arterial blood gas. One of the major components of an arterial blood gas is the pH. And it's worth noting that the pH is the negative log of hydrogen ion concentration. Ultimately, that just means that the concentration of hydrogen ions and the pH have an inverse relationship. So as the concentration of hydrogen ions increase in the blood, the pH will decrease. Now, this carbonic acid equation is going to be very important as we talk about arterial blood gases. You can see here carbonic acid, H2CO3, can either be broken up into water and carbon dioxide or a hydrogen ion and bicarb. Now, when we talk about hydrogen ions, it's really important that we're understanding that a hydrogen ion is an acid, whereas your bicarb, HCO3 negative, is what we use to buffer our extra acid in the body. The Henderson-Hasselbalch equation is listed below. It's simplified as pH equals bicarb divided by CO2. When we talk about the anatomy of an arterial blood gas, there are four main components. You have the pH, the CO2, the oxygen or O2, and the bicarb, HCO3. Now, it's worth noting here that we use PaCO2 and PaO2, and that's just indicating that we're talking about the partial pressure of arterial blood, which is where you have the P and then the small a. The equations that we're going to be looking at and the blood gases that we're going to be looking at are arterial blood gases. The normal values for a capillary blood gas or a venous blood gas are going to vary slightly. For this particular video, we're just going to be focusing on arterial blood gas. So you'll always see PaCO2 or PaO2. An ABG is often written in the following format, with the pH followed by the CO2, followed by the O2, followed by the bicarb. Oftentimes, we omit the pH before the number and just write it as 7.37/38/89/24. Now, this can lead to a lot of confusion whether you're a newer nurse or at a different facility, and they might say things differently. So it's really important if you are reading off an arterial blood gas that you say pH is 7.37, the CO2 is 38, the O2 is 89, and the bicarb is 24. That eliminates any possibility for confusion. So we've determined that there are four major components to an arterial blood gas. You have your pH, your CO2, your oxygen, and your bicarb. Your normal value for your pH is 7.35 to 7.45. Your CO2 is normally 35 to 45. Your oxygen is normally 80 to 100, and your bicarb is normally 22 to 26. Now, when we look at the Henderson-Hasselbalch equation, pH is bicarb divided by CO2, you'll notice that 3 out of the 4 variables are included in this equation. However, we are missing the oxygen portion of it. So normally when you're naming an ABG, you say uncompensated respiratory acidosis. However, if that oxygen is less than 80, it's really important that you indicate that the ABG is indicating hypoxia. So your ABG then becomes uncompensated respiratory acidosis with hypoxia. When we talk about the normal range of our ABG, it's all on a spectrum. Your pH scale, your normal, is 7.35 to 7.45. If your pH is less than 7.35, you are more acidotic or you have acidosis. If your pH is greater than 7.45, you're called alkalotic or you have alkalosis. So we can use the spectrum to not only describe the pH, but also the CO2 and the bicarb. When the pH is less than 7.35, you have more acid in your body and you are more acidotic. Likewise, if your pH is greater than 7.45, you have more base in your body and you're more alkalotic. Now, the CO2 represents your respiratory system. CO2 is an acid, therefore, if you have more acid in your body, more than normal, which is 45, you'll be acidotic. Similarly, if you don't have enough CO2 or enough acid in your body, you'll be more basic or alkalotic. Bicarb represents your metabolic system. Bicarb is a base and helps balance the acid in your body. So if you have too much bicarb, you have too much base, and you're greater than 26, you're going to be more basic or alkalotic. Likewise, if you don't have enough base, you're not going to be able to balance that acid that's in the body, and you'll become more acidotic. So remember, pH equals bicarb divided by CO2. Bicarb represents your metabolic processes in the body, while your CO2 represents your respiratory process in the body. Both your metabolic and respiratory process work together to maintain your pH. If one of them is out of balance, the other will try and compensate to maintain an equal balance. So if we say our pH is normal, 7.35 to 7.45, that means we have a good balance between our CO2, which is our acid, and our base, which is our bicarb. If we're acidotic, that means our pH is less than 7.35, and we have more acid than we do base. If our pH is alkalotic, which is a pH of greater than 7.45, that means we have more base than we do acid. So our body likes homeostasis. We like to maintain a pH of 7.35 to 7.45. And we use not only our respiratory, but also our metabolic processes to maintain that homeostasis. If we continue to have an abnormal pH, it can cause a right shift of the oxyhemoglobin curve, which decreases hemoglobin's affinity to oxygen. It can also decrease medication efficacy and increase electrolyte shifts. Our respiratory system and our renal system are used to maintain homeostasis. Our respiratory system is responsible for adjusting our CO2, or the amount of acid that we have in our body. The renal system is very important to help regulate the amount of bicarb that we have in our body. As mentioned previously, our body likes to maintain a pH of 7.35 to 7.45. If for whatever reason our pH begins to fall outside of that normal range, we use buffer systems to try and maintain homeostasis. The first system to talk about is the respiratory system, which can alter the amount of CO2 or acid in our body. We adjust the CO2 in our body by altering the rate and depth of our breathing. If we increase our respiratory rate, that means we're blowing off or getting rid of more CO2 or getting rid of more acid. That makes us more alkalotic or more basic. Likewise, if we decrease our respiratory rate, we're retaining more CO2 or retaining more acid and becoming more acidotic. Now, the respiratory buffer system is initiated within seconds to minutes of an abnormal pH. The other buffer system that we need to talk about is the renal system. Our kidneys can alter the amount of acid and bases in our body, and we can excrete acids into our urine, or we can reabsorb bicarb. Now, this buffer system is a slower activation and generally takes hours to days after the initial abnormal pH is noticed. Therefore, ultimately, we start the buffer system with our respiratory system, if possible, and then allow time for our kidneys to kick in and either excrete acid or reabsorb bicarb to maintain homeostasis and a normal pH of 7.35 to 7.45. So when we're talking about acidosis with a pH of less than 7.35, means we have more acid than we do base. So what causes us to become acidotic? So you can become acidotic because you have increase of acid or because you're losing too much base. Either way, you have an increase of your hydrogen ion concentration. And as we mentioned earlier, there's an inverse relationship between your hydrogen ion concentration and your pH. So as your hydrogen ion concentration goes up, your pH goes down and you become acidotic. So when we're talking about respiratory acidosis, again, your pH is less than 7.35, and that means we have more acid than we do base. We're retaining more CO2 than we have bicarb. This shifts the pendulum to the acidotic side. The causes of respiratory acidosis are a decrease in our respiratory drive. This can be from oversedation, an overdose, or sleep apnea. Certain neuromuscular diseases, such as myasthenia gravis or Guillain-Barré disease, can cause a decrease in your respiratory drive as well. And if you have an increase in dead space, either from a pulmonary emboli, COPD, or asthma. For a metabolic acidosis, your pH is still less than 7.35, and you're still shifted to a higher acid concentration than you do a base concentration. In metabolic acidosis, ultimately, this is because you have less base in your body. Therefore, it allows the CO2 and the acid to accumulate in the body. So what causes metabolic acidosis? You can have an increase in acid production, such as the production of lactic acid when you switch from aerobic to anaerobic metabolism. You can also have disease processes such as diabetic ketoacidosis or an aspirin overdose, which can increase your acid production as well. You can have a decrease in acid excretion, such as when you have chronic kidney disease or acute tubular necrosis, meaning your body or your kidneys can't get rid of the acid and it starts to build up. You can have a decrease in your bicarb, generally from diarrhea or a colostomy, meaning that you're excreting too much bicarb through your waste and you don't have enough bicarb left in your body to balance the normal acid that is already there. The other cause of metabolic acidosis is what we call cat mud piles. Now, cat mud piles is just an acronym for all these different things that can cause a metabolic acidosis. Everything from cyanide to carbon monoxide poisoning to lactic acidosis or salicylates. So what causes alkalosis, or a pH of greater than 7.45? It means there's more base than there is acid. There can be two causes for us to become alkalotic. You can have a loss of acid or an accumulation of base. Either way, there's a decrease in the concentration of hydrogen ions, which again, you have an inverse relationship between hydrogen ions and your pH. So as your hydrogen ion concentration decreases, your pH increases and you get alkalotic. Respiratory alkalosis with a pH of greater than 7.45 means that we don't have enough CO2 in our body or enough acid in our body. Therefore, it shifts the pendulum to the basic or alkalotic side. Causes of respiratory alkalosis is an increase in your respiratory drive, generally caused from pain or anxiety. In this instance, you're breathing off too much CO2 or too much acid, and you now offset your balance of acid and base. Other causes are any neuro causes such as stroke, meningitis, or tumors that can alter your respiratory rate. Certain toxins such as salicylates, nicotine, or progesterone can alter your acid-base balance. And then your pulmonary diseases such as pneumonia, pneumothorax, or interstitial lung diseases can cause respiratory alkalosis. Metabolic alkalosis is a pH of greater than 7.45 caused by an excess of base or bicarb. Causes of metabolic alkalosis is generally from an increased GI acid loss, such as through vomiting or excessive NG suctioning. You can also have an increased renal hydrogen ion loss. This is generally seen in Cushing's disease, hyperaldosteronism, loop or thiazide diuretic use. You can also have excess bicarb administration. This is generally seen when there's an increase in either bicarb drip or bicarb pushes in an effort to correct your pH. So let's talk about naming an arterial blood gas. In order to do this, we're going to travel to the land of ABG. So when we're naming an ABG, you have your first name, which is compensated versus uncompensated, your middle name, respiratory versus metabolic, and your last name, acidosis versus alkalosis. So the first step in naming an arterial blood gas is to look at your pH. Your first name is either compensated or uncompensated. If your pH is normal, 7.35 to 7.45, your first name is compensated. If your pH is abnormal, either less than 7.35 or greater than 7.45, your first name is uncompensated. The pH helps us determine not only our first name, but also our last name, whether we're acidosis or alkalosis. Now, acidosis is a pH of less than 7.35, and alkalosis is your last name if your pH is greater than 7.45. Now, what happens if you have a compensated ABG with a normal pH, 7.35 to 7.45? How do you know what the last name is? Well, we look at this kind of triangle, and 7.35 to 7.45, the median pH is 7.40. So anything less than 7.40 is going to be acidotic or leaning towards an acidosis. Anything greater than 7.40 is going to be leaning towards alkalosis. And that's how we determine what our last name is in a compensated pH. So if your compensated pH is 7.37, you're leaning towards the acidosis side. Yes, it's still a normal pH, but your last name will be acidosis. Likewise, if your pH is 7.42, yes, it's a normal pH, but you're leaning towards an alkalosis. So your last name will be alkalosis. Now, for those of you wondering what happens when your pH is 7.40, how do you name your last name? Ultimately, you'll never have a pH that is 7.40 repeating. So there's always going to be 7.401, 7.402, whatnot, that will actually lean you more towards an alkalosis. Similarly, if you're 7.397, technically you're still leaning slightly more towards acidosis. So let's go for a practice round. Just by looking at your pH, we're going to determine what your first and last name is. So if your pH is 7.18, your first name is going to be uncompensated. Your last name is going to be acidosis. If your pH is 7.48, your first name is going to be uncompensated. Your last name is going to be alkalosis. If your pH is 7.22, your first name is going to be uncompensated. Your last name is going to be alkalosis. If your pH is 7.38, your first name is going to be compensated because remember, we're between 7.35 and 7.45, and your last name is going to be acidosis because it's less than 7.40 or the median pH. If your pH is 7.42, your first name is going to be compensated and your last name is going to be alkalosis. If your pH is 7.58, your first name is going to be uncompensated and your last name is going to be alkalosis. If your pH is 7.36, your first name is going to be compensated and your last name is going to be acidosis. So now that we know the ABG's first and last name, we now need to determine the middle name. In order to do this, we look at our CO2 and our bicarb. Our middle name is either respiratory or metabolic. And we're looking at which value is abnormal. Is it our CO2 or is it our bicarb? Our CO2 represents the respiratory system and our bicarb represents the metabolic system. And remember, your normal CO2 is 35 to 45 and our bicarb is 22 to 26. An easy way to remember this is our normal CO2 is 35 to 45. You take your pH, 7.35 to 7.45, and drop your 7, and that's your normal CO2, 35 to 45. Your bicarb normal is 22 to 26. These are generally the ages that you wish you were, 22 to 26. So in order to determine what the abnormal value is it CO2 or is it bicarb, we have to look at each individual value and determine whether it's acidosis or alkalosis. So if we have a CO2 of 56 that is greater than our normal, 35 to 45, meaning we have more acid in the body, therefore it's acidosis. If our CO2 is 28, that's lower than normal, meaning we don't have as much acid in our body, and it's alkalosis. If our CO2 is 37, that falls within our normal category of 35 to 45. So how do we determine whether it's acidosis or alkalosis? Similarly to our pH, if it falls between 35 to 40 or the median CO2, we're going to be leaning towards alkalosis. If it's 40 to 45, we're going to be leaning towards acidosis or leaning towards too much CO2 or acid in the body. So with the CO2 of 37, we're leaning towards the lower end of CO2 or the lower end of acid being alkalotic. So when we look at the bicarb or the metabolic processes, our first number is 23. Now 23 falls between our normal bicarb, 22 to 26. However, just like we have done with CO2 and pH, we look at our median bicarb, which is 24. If it's 22 to 24, we're leaning towards less bicarb or less base. That's meaning that we're ultimately more acidotic. If we have a bicarb of 36, we're on the high end of having too much base and we're alkalotic. If our bicarb is 17, that means we don't have enough base and we're acidotic. So now you need to match your CO2 and your bicarb with your pH. So remember, we've traveled to the land of ABGs. And now in the land of ABGs, when you have a new baby ABG, you look at the baby's forehead, and on the baby's forehead is the pH. And when you look at the pH, you're able to determine the baby's first and last name. With a pH of 7.18, your baby's first name is uncompensated, and your baby's last name is acidosis. So now in the land of ABG, you have two baby daddies, and you have to determine who's the baby's father. So you look at your CO2 or Mr. Respiratory, and you see a CO2 of 65 is acidosis. Your bicarb or Mr. Metabolic has a bicarb of 32, which is alkalosis. So now when you look at those two, you look and see who's got the same last name as my baby. With a pH of 7.18, you have uncompensated acidosis. Your CO2 or Mr. Respiratory shares the same last name as your baby, so your full ABG name is uncompensated respiratory acidosis. With a pH of 7.48, your first name is uncompensated, your last name is alkalosis. Now, when looking at your CO2, a CO2 of 42 is going to be acidosis. A bicarb of 29 is going to be alkalosis. So your baby daddy is Mr. Metabolic. Therefore, your full ABG name is uncompensated metabolic alkalosis. With a pH of 7.36, your first name is compensated and your last name is acidosis. Your CO2 of 59 is going to be acidosis, and your bicarb of 26 is going to be alkalosis. Therefore, your full baby name is going to be compensated respiratory acidosis. If your pH is 7.24, your baby's first name is uncompensated, your baby's last name is acidosis. When you look at your CO2 of 30, the last name is alkalosis. Your bicarb of 12 is going to be acidosis. So your baby shares the same last name as Mr. Metabolic, and your baby's full name is uncompensated metabolic acidosis. So what happens if your CO2 and your bicarb both match? In this instance, you have a pH of 7.18, so your first name is going to be uncompensated, your last name is going to be acidosis. If your CO2 is 65, your name is going to be acidosis, and your bicarb is 12, which is also acidosis. So because both respiratory and metabolic are indicating acidosis, which one's the baby's father? So your baby's name is going to be uncompensated mixed acidosis. There's both a respiratory and a metabolic process that is contributing to the overall acidosis. What if your pH was 7.48? Your baby's first name is uncompensated. Your baby's last name is alkalosis. With a CO2 of 35, which is also alkalotic, and a bicarb of 29, which is indicating alkalosis, your baby's name is going to be uncompensated mixed alkalosis. Both the respiratory and metabolic processes are contributing to the alkalosis. If you have a pH of 7.36, your first name is going to be compensated. Your last name is going to be acidosis. If your CO2 is 59, your respiratory name is going to be acidosis, and your metabolic name of bicarb of 16 is going to be acidosis as well. Your full name is going to be uncompensated mixed acidosis. Again, you have both a respiratory and a metabolic process contributing to your acidosis. If your pH is 7.24, your baby's first name is going to be uncompensated. Your baby's last name is going to be acidosis. With a CO2 of 60, Mr. Respiratory is acidosis. The metabolic or a bicarb of 14 means your metabolic name is going to be acidosis as well. Your baby's full name is going to be uncompensated mixed acidosis. So when we talk about a mixed acidosis, it's a combination of both a respiratory and metabolic acidosis. It may be due to pathology such as tissue hypoxia due to a secondary respiratory depression, or it may be iatrogenic, such as a low respiratory rate set on the ventilator. Mixed alkalosis is a combination of both respiratory and metabolic alkalosis. It could be due to pathology, such as a neuro patient with neurogenic respiratory patterns receiving diuretics, or it may be iatrogenic, such as a high tidal volume or respiratory rate on the ventilator, or excess bicarb administration. Thanks for watching this video. If you want more practice ABG questions, check out the QR code below or visit revitalizeeducation.org.